You are listening to Wellness Prescribed with Fisher-Titus Medical Center. And here now for Fisher-Titus Wellness Prescribed, I have Dr. John Parente, Director of the Fisher-Titus Medical Center Emergency Department. So thank you so much for taking the time to chat with us today.
Absolutely. Good morning. It's a pleasure to be here.
So there are lots of different things within the medical community. There's urgent care, we have minute clinics, we have general providers, and of course the emergency room. So what is the purpose of the emergency department then, with all these other options out there?
Yeah, so I think the initial purpose of the emergency department is to handle medical emergencies, as simple as that sounds.
Mm-hmm.
However, I think it's gone beyond that now, right? And healthcare is a broken system. I say this all the time. And what we do now is really serve as America's safety net. You know, when you don't have any other place to go, you can't get in to see your family doctor, or maybe you don't have a family doctor, or maybe you can't, wait that long to see your family doctor or a specialist. You come to the emergency department, and we sort of have that catch basin where we see all of these patients that sometimes really have no other place to go. So yeah, ideally we see the emergencies, but it's actually a small percentage of what we see on a day-to-day basis, especially in a small community emergency department like Fisher-Titus.
So what are some of the most common cases that you're seeing then in the emergency department?
So the cases that we see are usually seasonal. So in the summertime, we'll see, cuts and scrapes and injuries and fractures and things like that from the kids playing outside. Sunburn, poison ivy, we see that kind of stuff in the summer. But as we head into the fall and even now towards winter, a lot of the stuff that we see here is more infection related. We're going to see, coming into flu season, we've had a couple of positive flus already. We're still kind of seeing COVID linger around. And for whatever reason this year, we're seeing a ton of pneumonia, especially pediatric pneumonia. So as the kids get back to school, unfortunately, those germs kind of get spread around from kid to kid, and then they bring them home to mom and dad and the other kids at home. So a lot of what we see in those fall and winter months, even into early spring, are more infection related.
So then, I'm a parent and, even just with myself, sometimes you're kind of on the fence. Should I go? What do I do? Should I wait it out? How do you know if you need to go to the emergency room for something?
And that's like the $1 million question, right? And I say this, there's obviously two sides to every story. As an emergency physician that sees these patients all day long, it can be fairly exhausting to just continually see influenza all day long, knowing that there's really not a whole heck of a lot that I can do to help you. That being said, I'm a parent too. I've got 3 kids. And if you feel that your child is in need of emergency medical care, come see us. We'll see you. And it's hard. As a parent, it's hard because your kid, if they do have influenza or COVID or pneumonia, they look miserable and they feel miserable, and you want to do something as a parent to help them. From our end, it's a little frustrating because there's not that much we can do. Now, pneumonia obviously needs antibiotics, but with flu and COVID, there's really not much treatment other than supportive care for symptoms. So I think as a parent, if you feel that your child is, truly having an emergency, come see us and we'll sort it out.
And then, so what happens, if people are, maybe it's been a long time since you've had to go to the emergency room. Like, what happens? Who do you see when you get there? What's the process like?
Yeah, the first thing you're going to see is registration and a triage nurse. Obviously get your name in the computer, that kind of stuff. And then the triage nurse is there to function to see, is there someone that's here that has a life or limb threatening, process going on that needs to be brought back right away? That's their first sort of level of triage. And then at that point, then you will be either seen by a physician assistant, nurse practitioner, or a physician. And I think a lot of people get that kind of confused and expect, the old school thinking is, well, you're always going to see the doctor. Well, that may not be the case. Most emergency departments, just about all emergency departments at this point, have some type of mid-level care, whether it be a PA or an NP.
So with that, I know a lot of the people are kind of put off going to the emergency room because they assume there's going to be a long wait or,
right.
You get there and there is a long wait. So what are some of the reasons behind why that is a thing that happens within the emergency department?
Yeah, so that's a great question. Number one, we have staffing challenges just like every other industry on earth, it seems right now. There's a huge nursing shortage across the country. I think COVID really was a catalyst for prompting nurses to either retire, go work at a med spa or some other, discipline in medicine. Some people just went into real estate or some other, career path. So it's really caused a huge shift in what we're able to do. There's a lot of back end hurdles in the emergency room that do cause delays that are completely beyond our control. control. For example, if you're admitted and you're waiting to go upstairs, but there's no beds upstairs, well, then you have to just be what's called boarded in the emergency room. So you're just kind of sitting there waiting for a room. And when you start to get that, then all of a sudden you have an 18-bed ER that's full of, say, 8 patients who are boarding. Well, now you have a 10-bed ER. And so it just makes it a lot harder to get that throughput that is needed in order to see more and more patients. And like the rest of the world, we're doing more and more and more. And sometimes we have less and less and less resources. It makes it very challenging.
Yeah, well, then especially, too, if people are having various types of testing and things like that done in the emergency room, some people, it's going to take more time to get them through. So what sort of tests and exams do people encounter while they're there in the emergency department?
Yeah, everything's pretty much driven by the, complaints, whatever that complaint is. If they're here with belly pain, there's a good chance they're going to get labs, they're going to get a urine test, and they're going to get a CAT scan or an ultrasound, some type of imaging. Not always, but that's pretty standard. If they're there with chest pain, they're going to get an EKG, they're going to get x-rays, and a lot of times they're going to get blood work too. Now, if you're just there for something simple, like you rolled your ankle, then yeah, you may just need an x-ray. Or, and like we talked about before with the infections, if you're just there with, a virus or something like that, you might get some nasal swabs or maybe a chest x-ray or like a strep test. So there are some tests that are, sort of more complaint specific.
And then if you have a very severe reason for visiting the emergency department, will you be transferred somewhere else, or how does that process work, and how do you determine those things?
Yeah, so we have protocols in place for just about everything, but it's really based on the ability of your hospital to manage that condition. So, for example, if you, God forbid, you're in a car accident and you have a major head injury and you have bleeding inside your brain, well, then you need to be seen by a neurosurgeon, and most community hospitals don't have neurosurgeons. So at that point, you would have to be transferred to a trauma center. So it's really dependent upon what specialty services are available at that particular hospital. At Fisher-Titus, we're very blessed. We have a very wide variety of specialty services, which a lot of community hospitals don't have. Now, yeah, certainly we still transfer out, I think, roughly 4% of our patients. So there's still some patients that do require a higher level of care. But for the community to have the level of resources at this hospital is truly a blessing.
And with that, with the different types of trauma centers, Fisher-Titus for the area, there's other medical centers in the area, but you're a level 3 trauma center?
That's correct.
And what does that mean then? I guess comparing, with that different levels.
Yeah. So level 3 is basically sort of the entry level of trauma. And what that means is that we have the ability to take care of traumas, and we can actually even admit a lot of trauma patients to our facility. So that's a good thing. When you get into like level 1s, those are the patients that are, multiple gunshots or have bleeding in the brain, very, very severe, high acuity type processes that do require multiple disciplines to come in and help that person. Mm-hmm. So yeah, I mean, the level 1 centers are going to be in, Cleveland, Akron, Toledo, the bigger cities. But for us to have level 3 is great, because then it means that we can take care of a lot of our patients in the community and still do a good job and meet a lot of the metrics that we need to hit.
Great. That's great. So if someone has found themselves in the emergency department and, you're done and you're out, what happens then? Do you have to let your primary care provider know? What sort of follow-up do you do? Do you guys handle that? What do we do after this?
Yeah, we always refer you to see somebody, whether it be your family doctor or if you need a specialist, like if you had a kidney stone and you have to go see a urologist. So we always give you that referral. As far as the ability to communicate with physicians, we, for the most part, in the community, we all use the same computer system, so they're able to see a lot of what happened in the emergency room, and they can get reports and blood work and CT scans and kind of see those things. So it's still not perfect, because there are still people that maybe went to Firelands for something and we don't have their computer system. And unfortunately, I think the average patient out there doesn't know that. And that kind of creates some hurdles, because if you went to Firelands and you had all this testing done and then you come see us, we can't see it. So we have to find a way to go get it or get the medical records. So, luckily within the community of Norwalk and some of the surrounding areas, the patients that do come to Fisher-Titus, we are all on the same computer system. We're able to see a lot of those things.
Okay, so earlier we talked about the common cases that you see, and you say, seasonally things happen where you see more things depending on the type of year. So we're getting into winter now, and what sort of things then are going to be posing dangers to people that they may need the emergency department?
Yeah, definitely. The infections are always one of our biggest chief complaints. But the other thing that we see a lot, especially as the population gets older, is we see falls. And people don't realize how big of a deal that is, especially when your elderly patients are falling. They're falling on the ice. They're falling, and breaking their hips. They're hitting their head. They're falling on an outstretched arm, injuring and causing fractures to their upper extremity. Those are the things that we definitely see more of in the winter. We do see a little bit more of like the car accidents and things like that because the roads, obviously are going to be slippery and that. But the one thing I'll tell you about trauma in the winter is it's kind of interesting. People usually go slower. So a lot of times what we see as far as trauma is a little bit less severe because I think people are more cautious. In the summertime, you get motorcycles going 80 miles an hour, cars that are going very fast. It's sunny. It's nice. Hey, let's go 80 miles an hour. And then that's when you get into some of your real severe traumas. That's not to say we don't see severe traumas in the winter too, but I think for the most part, people just drive more cautiously, but you still see some fender benders and things like that.
Yeah, interesting. And with that, let's talk about prevention then. Again, talking to Dr. John Parente, Director of Fisher-Titus Medical Center's Emergency Department. What are some good ways that people can not see you at the Emergency Department?
Just don't make bad decisions.
Okay, yeah, there you go. Make good choices.
Yeah. No, honestly, the biggest thing as far as it's really complaint based, right? So if you're trying to avoid infection, which is almost impossible, it's still, been the same way for hundreds of years. Hand washing. Hand washing is the single biggest way to prevent the transfer of communicable diseases. I know for a while there, and we don't need to debate this at all, but people were wearing masks and we were uncertain about their efficacy and all this stuff. At the end of the day, there's been a huge case study and a huge review on this. It still comes down to hand washing. So hand washing, properly covering your mouth if you do have to cough with the sleeve and your elbow, not with your hands. Just some basic things like that are some ways. And then, don't make bad decisions because then that's how you end up in the ER.
Yeah. So then what are some misconceptions then that people have about the emergency room?
Boy, I don't know where to start on that one. I think one big misconception is that with the payment structure, they say, all that money is going to the doctor. No, I wish it was true, but it's not. And, doctors' salaries are about $8 to $9 out of every $100 that's spent in healthcare. So it's a very low number. There's usually two charges to the emergency department. You have your physician fee, and then you have a facility fee. And that facility fee can be quite a lot because that's a hospital fee where you have to pay for the hospital. You got to pay for the nurses. You got to pay for the lab techs. You got to pay for the radiology techs. You got to pay for utilities and electric, and all those things and the supplies that's needed. So that's a way bigger bill than just seeing the physician. It's a much smaller piece. So I think that's definitely one of the misconceptions of the ER. But I think another thing that people sometimes get a little bit concerned about is if they're not brought back right away. Well, that guy he doesn't look as sick as me and he's coming back. And, that gets challenging because we do have obviously the triage system, but what we also have is a fast track. So there is a possibility that you may be in the waiting room, unfortunately, waiting for a bed with something like abdominal pain, which, may be something serious, may not be. When a person that just rolled their ankle walks right back, and that's because the fast track is open and we're trying to get patients, through as quickly as we can. And obviously, we're not going to put the person with belly pain in the fast track. And so it kind of gets, sometimes I think patients get a little frustrated, and that's why we try to communicate with them while they're in triage, like this is what's happening. And quite frankly, a lot of times we just start the workup while they're in the waiting room waiting to come back and see us.
So is that fast track then, is that things that you anticipate not taking a long time to treat and go through then? Okay, so somebody that, might just need a quick once over is going to go through before trying to diagnose what you might have going on. So that's good to know then. So thank you for for that information. Again, Dr. John Parente, Director of Fisher-Titus Medical Center's Emergency Department. We are out of time, but if people want to get more information, fishertitus.org. I know you have information up there in the emergency department. You have podcasts that you do as well, and lots of great information there for people if they want to find that again at the website. Yeah, absolutely. It's available at fishertitus.org/podcast. All right. Thank you again for taking the time to chat with us today. Thanks for having me. I appreciate it. You've been listening to Wellness Prescribed with Fisher-Titus Medical Center.